Welcome to Queen City Skin, the podcast where skincare meets science and confidence is always in style. I'm Dr. Elizabeth Rostan, board-certified dermatologist and founder of Charlotte Skin and Laser.
And I'm Dr. Emily McLean, a board-certified medical dermatologist at Charlotte Skin and Laser. We're here to cut through the noise, from social media myths to marketing hype, and bring you clear, evidence-based advice on caring for your skin at every stage of life.
Whether you're looking for everyday skincare essentials, the truth behind trending treatments, or lifestyle tips to age gracefully, you'll find it here.
Because healthy, beautiful skin isn't about perfection. It's about feeling confident and healthy.
Let's get started. Hello, everyone, and welcome to another episode of Queen City Skin Podcast. I have the distinct pleasure today of having with us one of our most beloved nurses, Kristin Brunson, RN. She is a nurse injector who also does some procedures as well. She's been with me more than 15 years, and we are going to talk about today our most recent trip to the Global Aesthetics Conference 2025 in Miami, Florida. I can tell you we put in the time. We have lots of things to share with you. I mean, Kristin, was it not from like 7:30 in the morning to 6 at night?
Yes.
Yeah.
Plus some.
Yeah.
Yes.
I think Kristin was on the way home. Kristin's like, oh, I hope I don't have to go to a soccer game. Please, no. So
give me my sofa.
I myself even have to confess I had to take a nap to catch up when we got home. Yeah. So Global Aesthetics Conference, I don't know what year they started, but it brings in multi-specialties, mostly derms, plastic surgeons, some, but facial plastics, lots, oculoplastic surgeons, lots of med spa owners, and then industry experts in practice management, technology, leadership, just really good stuff. So Kristin stayed most of the time in the minimally invasive big hall, and I darted up to the surgery hall for a little bit and come back, and then I'd dart over to the practice management leadership. But she and I observed some common themes that I thought we'd talk about today. Very exciting. So I took some notes, but I think the major theme of the conference was regenerative medicine. Do you agree, Kristin?
Yes.
Regeneration,
absolutely.
renewal, take care of yourself, take care of your skin, and just over and over again. Did you not hear just these themes?
Yep. It was like in almost every speaker, they may have been speaking about something different, but it all came back to overall regenerative.
Renewal, regenerative, repairing, all that good stuff. And I think it showed up in skincare, approaching skincare, not only from a preventive, but a regeneration. And then that's what I've been telling our patients for a while. Is like, this is skincare 2025. We can harness the power of skincare to renew fillers, including fat. And what else, Kristin?
Oh, nanofat.
Nanofat. Exosomes, new player. You've been hearing it a lot from us if you've been in. And then I think also nutrition and wellness showed up, but in a regenerative type manner. So with that list, let's dig a little deeper into the skincare. And a lot of these products are products that we already carry now, but I heard them show up a lot. One of them was the exosome, the plated product.
Yep.
And how much did you hear it in the lectures you attended?
I heard a lot about plated. I heard a lot about exosomes.
So exosomes are the little packages of surprise and delight that are released from a cell at the point of stimulus or injury or something like that. So those exosomes are derived from platelets. So I think, biology 101, you cut yourself, you injure yourself. One of the first things to respond are the platelets, and they release, and turns out via exosomes, a lot of healing factors, reparative factors, restorative, and hence we think this is important to harness renewal Is the plated eye that new? Everyone talked about it.
I don't know, but the plated eye showed some really nice results in.
Oh, y'all
in
can
the
look at me.
photos, and-
I started using
yeah.
it a month ago. Not even a month ago. Yeah, about 3 weeks ago. Recently went on a trip to Italy. Lots of degeneration there, I have to say, with eating and sugars. And I'm on the reparative process now. But I took that thing with me.
Yeah,
We
well, it's
carried
tiny,
on.
and it's
I mean, that is
tiny.
high praise. It is good. And this gal here is old. Kristen's young. But I think she's committed to trying it now from all that she
I
heard.
do have it, but I mean, and it helped like the vascular components right under the eyes. So we do get questioned a lot about that. But
Tell our audience what the vascular, how we pick up on the vascular component.
a lot of people ask about dark circles, and when you look closely, you can see redness, purple, darkness, and it's usually broken capillaries or a little
showing through the thin
purpleness.
skin.
Yeah, thin skin.
Yeah, so we call that vascularity. But I mean, we've seen plated help with rosacea, the red face, the flushing face. So it's absolutely logical. I'm actually a little embarrassed it didn't dawn on me sooner, but you're right, it does help. And then from the regenerative standpoint, the fine lines, it's just good stuff. Yeah, lots of growth factors and peptides, including some of our favorites that I use, the bio cream. That might be your favorite as well.
Yep, the Lumiere eye cream by them.
Yes, and also I heard someone mention factor 5. Only in very few sessions were brand names used. You had to kind of make some guesses. But yeah, factor 5 was mentioned. So using growth factors and new peptides coming to market too. We heard about some of those. What did you hear about in the peptide department that caught your attention?
I think just a lot of what we use already. The Definage, well, that's a little different than peptides, but Definage was talked a lot about. But
Some new peptides.
the new Cutis was one of the biggest ones, and how a lot of doctors and practitioners were using the eye cream, the Lumiere, for some scar treatments or other
applications.
ways, because it has such healing in it. People love it for eye, but also for other
Heard a lot about
applications,
that and definition. What happens when you go to these meetings? We learn about some new things. We learn some new ways to use products we've been using for a long time. And lastly, you get affirmation about the way that you're using things. You're like, oh, they're doing it in New York and California and Florida and Texas, and they're getting great results healing from laser. And so what you do is you come back from this meeting armed with all this stuff. Imapel was also discussed. That is a cream that mimics the effect of estrogen in the skin. And I like this one. Patients listening that have come to see me know that I recommend it because it also has the night cream has a retinol in it. It's a good retinol. So you get this replenishing of the estrogen effect. It's not estrogen on your skin. It just mimics the effect, and a good retinol. So that came up, and I was delighted to hear that mentioned. But some new things. There's a new elastin, and we're on to that as well. I don't know that we've informed our audience yet, but because it just rolled out, and it's got a new peptide called Octa45, which is in addition to the trihex technology that we're all familiar with, which supposedly gets rid of the old structure and helps remodel new structure. The Octa45 apparently down-regulates genes associated with cellular senescence, another buzzword we heard a lot of at the...
Yeah, we did.
You sit in the meeting and you're like, my God, I'm getting old just as I sit here. Cellular senescence. And you'll hear us talk about this. This is, well, I talk about it a lot in terms of fibroblasts, right? The fibroblasts sit around your skin and they go into early retirement. Okay, they're like a European country, early retirement, but they're collecting full benefits. They don't go anywhere, but they're not doing anything. And so we thought that was the case. So when we have you come in to do one of our regenerative treatments with laser or filler, we're trying to wake up that cell and make it start doing its job. Well, what we've learned is with ongoing time, not only these cells sitting there doing nothing, it's like the adult child that won't leave home. They're contributing to the downfall of your household, leaving dirty laundry around and not picking up after themselves and clearing out the fridge without going to the grocery store. They're sending out bad signals that further enhance and increase and accelerate aging. That's the senescent cell that's kind of turned into an ugly player. Now, it's not just sleeping quietly like a toddler in a good nap. It is wreaking havoc sometimes.
Or sometimes it's called the zombie cell.
Oh, the zombie. Well, we were there in Miami over Halloween.
Yes.
That's a great analogy.
We saw some zombie
The
cells.
zombie cell. So ladies and gentlemen listening, if you just think, well, it's okay, I don't need to do all that, I'm just going to age gracefully, realize this little fibroblast in your skin is sitting there and he's not dormant, he or she, well, neutral, I guess. It is sitting there just making problems, increasing aging. So again, we're back to this regenerative medicine. And so there was another product that I hadn't heard of, or maybe I did, I guess I didn't pay attention to it, that also targets senescent cells called OS01. We will be looking into this, audience, and digging deeper. And if we think it's worthwhile, we'll bring it in. One other one called BioBlend. And then kind of a little beginning to become a cult sunscreen, I think, is that Pavise.
Yeah.
You're going to have to shell out some money for this sunscreen, but it's got anti-inflammatory, antioxidant, cellular repair. Yep. Did you talk to anybody personally about it, or just saw it in the lectures?
I don't think so.
I mean, it showed up so much.
Times. All three of those did, yeah.
Yeah, they just clicked through the slides. They're like, oh, we all have seen this.
Yep.
Oops, seen this. So I'll definitely be looking into that and thinking about bringing that in. But the idea is your sunscreen doing more for you. And Elta is onto this idea. Some of our Elta products already have a little antioxidant hydrating materials. They've got anti-inflammatory. One has a green color. But adding things to your sunblock so that your sunblock is doing more work for you.
Yeah.
Me personally, I don't have any trouble layering a bunch of stuff on. But it's nice to know your sunblock is giving you something additional. So lots of talk about skin, and I was actually on a panel with how many other physicians? You were there.
The ladies?
The ladies, yes.
I think there was like 7 of you. I was just looking at that photo. There's like 7
It was like
women.
the divas.
8 women.
The divas of cosmetic surgery. And God, these women, y'all would love them. Wouldn't they love them? They're the most strong, successful, smart, outgoing, beautiful women up there. And then here Dr. Toad sits, but whatever, it was fine. And that little Korean doctor will come back to her.
So cute.
It's adorable.
Yes.
But everybody said, what's on your bathroom shelf? And we only had 5 minutes. I didn't use all my time. And I have to tell y'all, we were scheduled at 5:15 in the afternoon. This is after starting at 7:30. There were a lot of people in the audience.
Yeah.
I was surprised. Yeah. And it was so funny. I'd look out and I'd see these men doctors furiously writing things down.
Were they?
Yeah. But
I was in the front, so I couldn't see behind us.
I concentrated on, if I did in 5 minutes what's on my bathroom shelf, it would have to be played at 20 speed, I think. No. So I said, let me just concentrate on the peptides, because peptides have become an important part of my routine north of 50, frankly. I still concentrate on the basics, antioxidant, sunscreen, retinol, and then I talked about some of the antioxidants in my regimen, which include the BioCream we've already talked about. It includes elastin.
Those are the peptides.
Yep. Elastin, Definage. Elta MD has a plant-based peptide. I use that. I was the only one that talked about the 2 new SkinCeuticals peptides, which I am not endorsed by SkinCeuticals. I can talk freely about all these companies. I'm not sponsored by them, but SkinCeuticals, I use the the PTOX, PTOX, and it's become already a fan favorite at Charlotte Skin and Laser. Wouldn't you agree?
Oh, yeah.
Yeah,
Absolutely.
So it has a peptide that inhibits the release of acetylcholine at the tiny little neuromuscular junctions. So the little fine crepey skin lines, crinklies here, lower cheek, eyes, forehead. Pairs well with Botox, right, Kristin? Kristin does so much Botox, which is just what we call relaxers, many kinds of relaxers. I just think it's great with that, don't you? Have you seen some good success?
For sure, and it seems to prolong the results of your relaxer. So, it's definitely paired.
I think it enhances satisfaction with the treatment because you just can't get every little line, and then makes the results last longer. And then the other one is the RGN6, which is a blend of some ingredients, including peptides, meant to help the skin heal after a laser treatment or filler, but mostly laser. But also in between your laser treatments, it's supposed to mimic that healing process. I think that's a useful one too. We can post on our YouTube some of the slides that I had, just so you know what I talked about at the meeting. Moving on from skincare, but so anyway, I mean, we just spent a lot of time talking about skincare. Skincare is not a, oh, by the way, product, a look in your rearview mirror product kind of thing. It's important. It's valuable. How do you frame it when you're doing filler and injectables with your patients?
Well, skincare, I mean, it shows a lot by looking at someone's skin. And I think I'm going to probably be doing it a little bit differently now after this meeting and hearing some of the ways that these folks have framed it. Like, I'm not going to treat through some poor or rough looking skin or some aged skin that needs some help or needs some nutrition. We're going to try to start by assessing from within. How are things on the inside? Because that's what's showing on the outside.
Absolutely. And I think that was another theme in terms of the regenerative, that lifestyle and that nutrition, and we'll just call the cellular environment.
Yeah.
Create a positive cellular environment for Kristin's treatments to work well, for my treatments to work well, for Brooke and Kat when you come in and you get some laser treatment. I just thought it was a brilliant talk. We heard a couple, and I think about it a lot. I've started my consultations asking my patients, how's your nutrition? Because some people are on these really restrictive diets, restrictive calorie-wise. You need that nutrition, and what you need is fertile soil. You need good soil. I can go throw grass seed on my dry yard that hasn't been aerated and not water it. Nothing going to happen. But if I take some seeds and stick them in the best soil that I have given nutrients to, I supplement it, it's got the right pH, and I put it out in the sun, I water it right, I'm doing all the right things, we're going to get a great growth in that pot.
Great, beautiful flower or plant,
right?
Or vegetable.
You need good soil for a pretty flower.
That's right.
Exactly.
Yeah.
And so I talk about it, I'm just letting our listeners know it's a common theme. And it's actually been talked about a little bit about why some people with Sculptra, polylactic acid, seem not to respond as well as others. And we think about that with laser too. And one of the theories is it's not good soil. You must take care of yourself, good nutrition, good skin care, sleep, healthy lifestyle, reduce sugar, minimize stress, And then gut health comes into skin also, almost sometimes more with the medical side, acne and other things. And then hormone replacement, putting all this together, again, regenerative medicine, creating some good soil in which for us to rejuvenate you, right?
Right.
Well, speaking of soil and what we put in the soil to renew, I think another big thing when the fillers was which kind of filler, Kristen? Biostimulatory.
Oh yeah, biostimulatory with Radius, Sculptra, hyaluronic acid, all of them stimulating collagen.
Almost every filler lecture mentioned biostimulatory filler. Again, the renewal process, regenerative medicine. Did you take any particular tips from the biostimulatory lectures you listened to?
I mean, everybody is interested in biostimulatory these days. Regenerative versus filling, overfilling. A lot of people are even scared to use the word filler these days. And this is probably going to bring up another topic, but the GLP-1s. We've got a lot of patients. There's a lot of people on those. And that's kind of what's given like this Ozempic face and craze.
Yeah, exactly. That was a theme.
Yeah, they're
we'll
the
definitely,
ones needing. Yeah,
definitely get back to that.
Needing this biostimulatory fillers. Yeah,
I talked about not sure. This was abroad. An update on fillers in 2025. And, you've got a 12-minute talk. How do you tackle this? Well, I tackled it with biostimulatory fillers, and but also using other procedures to enhance your outcome from fillers. But biostimulatory. So what I say to patients is, they meet with our consultant Alexa, and they tell her, "I don't want fillers." Well, I'm like, okay. And then I look at the pictures. I'm like, she needs filler routinely. And so I go in the room and I'm like, you need filler. I'm going to recommend filler, but not the filler you thinking of. This is biostimulatory filler. Some of my colleagues don't use the word biostimulatory, but I really can't think of a better way. Yeah. You are stimulating a biologic response in someone's skin, and that will do things like improve collagen, new elastic material, new elastin, extracellular matrix, better functioning of skin cells via the renewal of the fibroblasts and waking up the fibroblasts. So your skin starts to look a little bit better, sometimes a little bit of tightening because of that increased elasticity and also the response to certain fillers. So fillers can be used a lot of ways, but this biostimulatory is a really up and coming thing. And then, and you mentioned this, a lot of focus on the under eye. Less is more is what I heard.
Lots of talks on the under eye, and not so much doing the under eye. It's being cautious about doing the under eye.
Amen. Cautious about the under eye.
Yeah, and why people don't like to treat the under eye, or just being very cautious with the under eye.
In many ways, it's a very easy area because it's very safe, but it's challenging making it look very pretty and not overdoing it. So our patients that have had under eye filler, they love it, and then they come in, they want more, and I'm like, it's not, no more. We don't want to push you over that edge where you're puffy. The other thing I thought came up was the filler migration myth, which isn't really a myth, but folks, if I inject filler in your temple, it's not going to migrate to your cheek. Let me throw that out there, and because I think that's really out there. What we do see in areas of dynamic movement and planes of different movement, like the under eye, filler that has been there for a very long time can sometimes suddenly work its way up, and you see the puffiness. I can pinpoint it a mile away. But I find it very treatable. I think you do too.
Yeah, and it's very almost noticeable too. As soon as you walk in the room, It's very noticeable. And it's usually treated in most of the time one little shot of hyaluronidase.
So if it's hyaluronic acid, you can dissolve it with an enzyme called hyaluronidase, which we do use. I will often just numb it, poke it, and squeeze it out. I often say that the filler I remove in this clinic is not filler I put in. And that is almost always true, with the exception of the under eye. And it just can sometimes work its way up from a beautiful result to now it's causing puffiness. And I think it's just the dynamic nature, how the muscle in that area integrates with the underlying tissues, and the ligaments that kind of trap fluid there. And you just get this situation where you might get a little puffy, but easily treated. But I think at these meetings, physicians are very honest about mistakes they've made, just a great learning experience. And I have heard lectures about very humbling experiences physicians have had, and it's great that they share this with everyone. The sharing, I think, is important. But I think also a consensus on more of an ideal beauty. And the consensus at this conference, I'm relieved to say, the more ideal beauty is what's best for each individual. Okay, not this cookie cutter. You know, these days everyone comes in, well, not everyone, the young people come in with their phones. Kristin, I know you know this, and they've got images of maybe 5 or 10 celebrities or models and say, I want these lips and that, this and this and this. And, you know, if you look at these attributes of each of these beautiful people, I mean, it's beautiful, but it becomes really cookie cutter.
Yeah.
And I was relieved that these ladies working in Hollywood, Miami, New York City, Dallas, Texas, centers of beauty and wealth, saying to the audience, it is not my preference. Agreed?
Right. And the way they looked.
Oh, they look great.
You can really base something on how they look.
I'm almost getting too old to go to these meetings.
Great.
These women are so young and gorgeous. They do. And it just made me feel good because I know that's the aesthetic look we go for. I want people to look the best they can and maintain that youthful beauty. It has gotten trendy to create the X cheeks or the whatever lips, but if you go too far down that way, you lose the sense of your own self. And it was kind of a relief for me. I think you picked up on it in several lectures as well.
Yeah, it's very reassuring.
One of the lectures that I gave was about combining procedures with your filler for more of a comprehensive approach to get very natural results, but to avoid the overfilled filler face. Thankfully for my lecture, that overfilled filler face had already come up several times in the meeting, and I think was universally addressed as not ideal and certainly not good for our profession, because I think we can create beautiful faces that look very natural. You know, the best result I say is it looks like you had nothing done. You know, will I see a difference? Well, yeah, you will, but you'll look like nothing was done. And that, to Kristin and I, is the ideal.
Yep.
And then in my lecture, what I talked about is, you know, unweighting the lower face. We can do things to reduce fat and tighten, and maybe some threads to suspend. Come at the irregularities of aging with a multimodality approach. So you're not just like filler, and then you get this face that's just too full.
Yeah, one of the physicians said he tells his patients, you'll see a difference, I'll see a difference, but other people may not see a difference. And that's kind of what you want. You know?
It is what you want.
Yeah.
Yeah.
You don't want to look like you've had something done.
Yeah, you want to look, you know, you want your friend saying, gosh, looks like you've been sleeping really well. Amen, that's it. That's what I've been doing.
That's right.
Oh, which brings me to another one. Oh, that's a good time to talk about that lecture on Korean beauty.
Oh,
Okay, this was a physician, Korean physician from Australia. She had grown up in Australia, and that's where she practices, but she did a 2-year facial plastic surgery fellowship in South Korea, Seoul, I guess.
yeah, I think so.
And so she gave a lecture on the ideals of Korean beauty. And it was a very lovely lecture.
Yeah.
But basically, you can't sling a cat in Korea without hitting a cosmetic provider. We think that's one of the reasons the filler complications have increased so much. Not that these are bad providers, it's just they're done everywhere. Every street corner has multiple providers. They're often done very rapidly. They're done in high-risk areas prone to vascular occlusion. But she showed pictures of the subway, and it was just every other. It's no Coca-Cola, no Pepsi. It's like beauty, 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 plastic surgery.
Yep. And they have models and actors endorse them. She's like, even if it's fake, they'll say such and such actress. They endorsed us. Yes.
That's right.
So,
but what I took away from it, a big one, Kristen and I both, was the Korean personality. The people in Korea, they look favorably upon these cosmetic enhancements. It's kind of like getting a master's degree. I got filler. It's more than that. They actually have surgery. And many high school graduates are given by their parents money for plastic surgery at high school graduation. Your photo is required on applications because it's very valuable in their society.
yeah. And then she said they're very filtered. She's like, they're
Oh,
filtered.
the photos that you get, yeah. And then I also learned what this means on a photo. And it's helpful for me as a cosmetic provider in treating ethnically diverse populations. We do, when I have an Asian patient, I ask them how they want their eyelid to look because they like the little eye roll, just some little silkworm bug, silkworm underneath here. Caucasian women, United States women hate it. And so we actually inject Botox there. But if I have an Asian woman, I ask her, I'm like, do you want this or do you not want it? Because they often do want it. And then this is reshaping that lower face into a little kind of heart shape and very elongated chin and narrow jawline. And so this isn't just being cute. It's kind of illustrating either that you've got it or you're hiding it in the photo.
Hiding the wide
Yeah.
masseter.
To make that's a point that I learned, but I learned something. And a small face is ideal.
Another thing culturally is it's very prominent to have good sun protection, because if you were
I would
in
fit
the
in
sun,
beautifully.
if you were in the sun, that means you worked in the field, so therefore you had sun exposure. So that's why the Asians are very
umbrellas
covered from the sun. They look
Yep.
more of a higher status, but which helps them take care of their skin.
Yeah, it's a very nice lecture. And then her father was with her, and he was adorable. Anyway, it was really,
He was.
it was
The
cute.
little guy smiling all the time. He was cute.
She was on the panel of the diva ladies about what's in their bathroom shelf. But she basically said, mine's not very much, and it's all store-bought, and I have great skin genetically. Yeah.
Yeah, I don't
And
know.
another
Is
thing
that
she
true?
said, she goes, she starts her talk with, Asian don't raisin. And that's true, Asian don't raisin. But back to the United States, and another big theme was, as Kristin alluded to earlier, huge effect from the GLP-1s.
Yep. And it's not going anywhere.
And God, the lectures or the slides on butts. Every lecture had a
We
butt
saw
in
the
it.
same butt so
God,
many
there were
times.
so many butts. And then was it the hip dip?
The hip dip.
The hip dip. Nobody can tolerate a hip dip, which is where it caves in. I don't know. No one really.
Show you?
Yeah. No. Oh, yeah, let's see it. We might get censored. But astonishing effects from GLP-1. I did learn a little bit more about it. It decreases fibroblast function. We've already talked a little bit because we started talking about regenerative medicine and waking up those fibroblasts. We've talked about senescent fibroblasts and how bad they can be. But with the GLP-1s, it's more than just losing weight. You decrease fibroblast function with long-term GLP-1 use and increase what's known as MMPs, matrix metalloproteinases that chew up collagen. So we've got this degradation of collagen in the face of decreased fibroblast activity, which is supposed to help you recover from that. And also decreased adipose-derived stem cells. And those are also responsible for keeping your skin youthful. And there's a new term, relatively new, but it's showing up more and more. I think it's DWAT, dermal white adipose tissue, DWAT, dermal white adipose tissue. And that's the idea that in your skin, youthful skin, there's actually a little bit of fat as part of the skin structure, not just below the skin. We're used to the subcutaneous fat. This is kind of the small microscopic fat. There's a recent study that showed that Sculptra, PLLA, was able to increase DWAT. I think in the future we'll see more about DWAT and how to trigger it in aging skin. I think it goes a long way to explain why, if you compare mother-daughter or granddaughter, grandmother, it's just a complete difference in how that skin sits and part of it might be this DWAT and the adipose-derived stem cell creating a youthful environment. But profound weight loss in the face of loss of elasticity, and we learned something about how to restore that, mostly with the biostimulatory fillers, and in unusual areas. One physician had treated a woman who, you remember that one, couldn't sit. It was too uncomfortable to sit.
Her sacrum, yeah.
So he restored that by injections of a biostimulatory filler, PLLA, just short for polyl-lactic acid, or Sculptra. It takes a lot, but you could understand how game-changing this could be for someone.
Yeah.
What else did you see about restoration in those individuals? Nanofat. Nanofat would help, but they don't have any fat to harvest.
That's right.
That's the downside.
Yeah, there was some talk on the injectable fat.
The fat matrix.
Yeah, some of this fat matrix. So it's like fat in a tube. So if you don't have fat, because these GLPs don't have fat, but I don't know. I think the nanofat was pretty cool in what it did. But yeah, just the Sculptra and the Radius for restoring the
skin volume.
The volume. And
I imagine in the future we'll reach some sort of better middle ground with limited GLP dosing or something, or let these people recover a little bit. But profound weight loss alone can cause these problems, but then you throw in what we're seeing as a side effect of the GLP-1 medicines. We've talked a little bit about fat and nanofat. I don't do a lot of fat here, but I may start again because it's actually pretty easy to harvest. We'll just talk a little bit about it. I think this was new to Kristin. I had been exposed to it before. But so you harvest fat. Let's just say you've got, all right, who in the audience has a little bit of fat they think they could spare? I know I do. Right. So it's very easy. Under local anesthesia, you just take a little fat out. You can wash it and filter it through. So you let the fat come up and push off the water. And then you can use that as is. That's fat, but it's bulky. So I can kind of use it in the cheek. Because of the bulk and everything in it, you often have a lot of swelling. It takes a little while to recover. You need a good environment to put it in. You can do it to the breast. You can do it other areas. But we can take that fat and we can make smaller particles. And so the word they use is microfat. And what you do is you pass that fat back and forth through a filter like a sieve. Okay, it's like you're sifting flour or powdered sugar. You're making more fine particles. And the size of the sieve determines what your product is. So the next one is microfat. It's really not microscopic, but that's just the word they use. Then you can take that microfat and run it through an even smaller filter and get nanofat. So we've got big clumps, small clumps, and little bitty clumps. You can use all three in the same patient. So a little bit of big clump for some volume, a little bit of mid clump for, some finer areas. But then the nanofat, almost like we do a biostimulatory filler under the skin, in the eye area. Or we can combine it with radiofrequency microneedling treatment and rub it on the skin topically. Yep. We can needle it in. Just, how excited are you? I know. I mean, seriously. Everybody come in. Yeah. Let me get some of your fat.
That's right.
But it's kind of like how we're using PRP.
Yeah.
But this fat, boy, it was some. How about that neck result?
The neck was insane, and I saw.
I've been getting some nice results. I know Kristin has too, with the combination treatments of the biostimulatory filler with like an energy device, microneedling radio frequency. We use the Infinity Genius or even laser treatment. I'm like, those are some really good results, but. Dang, that nanofat.
And I saw a nice perioral also with it.
Oh, you did?
So that's why I was like, let's talk about this nanofat, because these are the bane of so many's existence. Right. Like, it's just
ready. Let's go deep on it. You and I, we'll go deep. Let's go. 2026 is going to be nanofat year.
Fat year.
Nanofat year. There were some talks about hair. I gave a talk on hair, but I wasn't the only one. There were a couple of talks about hair. The theme of my talk was making treatment of hair a little more approachable to some physicians that may not be used to treating it. Not everybody there was a dermatologist. And also encouraging physicians, as part of a comprehensive cosmetic plan, ask patients about their hair. Because great hair really is important to a woman. I think it completes her beauty. So lots of talk about hair. And then the neuromuscular relaxers, I would say we saw some interesting things in the neuromuscular relaxer. I think you were that.
Trap, good neck.
Oh, there's a new neck. I liked his technique. We're going to try it. Don't call immediately and sign up for it. We'll try it on each other or something.
Give us some time to work out some kinks.
I may try to get this physician FaceTime and see if he'll show us. But it looked really interesting. And it's unit sparing. It was only like 30 units max. The problem is with the current technique, treating the bands, we can really burn through some units. We try to be conservative, particularly my bands are big. Trap. Deltoid, I really don't see us using a lot of that. I feel like that might be more Miami Beach.
Oh, they did it everywhere.
Calf,
ankles.
And the ankles, I forgot.
They were putting filler into ankles too.
Right, I like my ankles. They're narrow, and I like my calf. I've got, if you ever behind me when I'm going up the steps, I have some massive calves. I think it's from horseback riding. They don't bother me one iota.
I would be scared to
Botox
my calves. Like,
I like the penis Botox. I had not heard of that. We'll just throw that out there. Just in case you thought this podcast was for women. We saw
and the filler.
Filler for the penis and Botox for the penis. Apparently, wait for it, gentlemen. It makes it hang lower and longer. Okay, we're going to have to add online appointments for this, I think.
Schedule with Dr. Rostan. She's accepting it.
But interestingly, there is a use for ED, erectile dysfunction, because it can increase blood flow. So that was interesting. And the filler, like I said, lots of butts. By the way, listeners, we do butts here. I've got quite a few butt patients, but it's just, again, Charlotte is not a Miami Beach or a Hollywood, Beverly Hills, but still. Balls of the foot. I have one patient that I feel like I've done foot filler on, and I can't remember why. I think she just had degradation of that fat pad on the ball of her foot and it hurts to walk. I had heard of it, put it in, I guess this was on the heel, on the ball of your foot for wearing heels. The woman I did was her heel because of loss of structure.
Oh, it seems like that would
So
hurt.
we had, as you can see, Kristin and I had a big meeting, honestly. You meet people. The other thing that I did is I popped out and I did a lot of the practice management and office efficiency, just making sure we're up to date on things that make your interactions with our office better, more friendly, more streamlined. Some leadership things, trying to lead my team in the most effective way I can. We focus a lot of that here at Charlotte Skin and Laser. But most of it, we were there just to learn some new things. And I didn't go to the beach at all. I looked at it. I could see it. And we went out to dinner twice. And we were there at Halloween, so they had this Halloween party. And I thought, well, everybody's here for a medical meeting. I mean, I think we were like the only one without a costume
Not dressed
on.
up. I know.
It was unreal.
I don't know how people packed a costume.
I don't either.
I couldn't have gotten.
But that was what this crowd was. They're very collegial. I've known a lot of them for years from going to multi-specialty meetings. I think it's great, and I'm glad we went. Are you glad you went?
I am. I love these meetings. I mean, you leave feeling very reassured because a lot of what we hear, again, are things that we're already doing. And I think that should be reassuring to us and to our staff and to our patients that, I mean, this was a global meeting and people around the globe from Korea and Brazil and I don't even know where else.
Yes. South America, Asia.
We're all doing the same thing.
Canada, Europe, some Europeans. Dr. Miguel from
Portugal.
Portugal, yeah, I was going to say Porto, but Portugal. Yep. Really good. Well, I was going to tell you what we didn't hear. Wait for it, audience. Not one iota, or Kristin may correct me, on salmon sperm.
Oh, yeah.
Okay? Not one.
I heard one.
You heard
one? I want to say it was the Korean.
It
was one. It was 12 minutes on it. Just one.
Oh, I missed it. So there, one on salmon sperm.
Polynucleotide. What is it?
Yeah.
Yeah.
Well, the problem with the salmon sperm, not to divert, is it's not regulated. So you're doing it for the polyribonucleotide, but you don't even know that if the product you're paying for has that in it. That's the problem. It's just very unregulated. So that's probably why a lot of speakers didn't talk about it either.
Yeah, or it would have been in with.
Well, thank you all for tuning in. We welcome your comments, questions. We've thrown up a lot of things that probably we don't fully understand yet. They're new to us, but we'll be offering them if we think they cut the mustard for providing the best aesthetic services to our patients. And we look forward to talking with you in our next podcast. Thank you very much for tuning in. And thank you, Kristin, for joining us.
Of course.
Yay, Kristin.
Thanks for having me.
Thanks for listening to Queen City Skin with Dr. Elizabeth Rostan and Dr. Emily McLean.
We hope you're walking away with tips and insights you can trust, and maybe a little extra confidence too.
If you enjoyed today's episode, be sure to follow or subscribe so you never miss a dose of skincare wisdom.
And if you have questions you'd like us to cover, connect with us at Charlotte Skin and Laser or find us on Instagram at Charlotte Skin and Laser.
Here's to healthy skin and feeling your best. We'll see you next time.